think that's enough.
Now, I would like to introduce another very important guest. Her name is Tracy. She's a star athlete at Washington Regional High. And they are so proud of her because in only her freshman year, she was on the varsity team as a starter. Let's listen to Tracy's story. Now, which sedative do you have an addiction or dependency on?
I have a dependency on alcohol.
And you're only a freshman? How could this have happened?
Well, when I was growing up, my parents, they were the cool parents. You know, the type that lets their kids drink and party and do whatever. So I used to just have, like, maybe a glass of champagne on New Year's. But then it just got out of control and I'd be having daily beers out in the dugout. And it's so hard to talk about.
I feel your pain.
I really do. And I think.
And now we're going to have a talk with Dr. Phil so he can explain to you some of the long-term effects. But first, let's talk about some of the side effects that you've been experiencing.
Well, I've had a lot of nausea and headaches, but also I seem to have decreased motivation. I used to be an A student, but now I've been getting C's and D's, and it's not the same. And I've been having some really weird dreams lately.
Yes, those are all quite common, but there are also some others that you could experience should you continue. These include lethargy and oversedation, irritability and skin rashes, impaired sexual functioning, menstrual irregularities, tremors, and loss of appetite or increased appetite as well.
Okay, and these are just some things that she was known for doing, such as coming to practice drunk or under the influence, and it's a very sad sight.
That's amazing.
Obviously, that was some very disturbing footage. I mean, to see a girl with such potential to do so great in a sport like that, it hurts us all. What are your feelings on that, Tracy?
I don't know.
Like, do you feel like you needed to be doing that kind of stuff, or?
No, but it smells so good.
Do you feel like you let your team down, seeing how destructive you were?
Yes. Yes.
Well, I guess, if nothing else, your motivation to others to beware and not do such stupid things.
Hey, wanna smoke this joint with me? No, man, I'm good. Come on, man. Just do it with me. No, really, I don't I'm not trying to hurt you. I'm trying to help you. No, man, I don't smoke weed. I smoke fools like you on a b-ball court. Goodbye.
She's one of our most surprising guests. She is not only a straight A student at Washington Regional High, she is not only a chess club captain, but Penelope Peters is a drug abuser. Now, Penelope, what is your drug of choice?
Marijuana. I like to call it herb.
So now we're going to talk about your dependency on this substance you call herb. Do you know that it is a gateway drug?
No.
Do you know what a gateway drug is?
No.
A gateway drug is a drug that once you build up a tolerance, it leaves you wanting a more stronger high. So you could be using stronger substances such as cocaine or heroin that we all know is very dangerous drugs.
Okay, well, first of all, my eyes get all bloodshot, and my mouth gets all dry, and I can't even spit. My mouth is so dry.
and then, but I'm just so carefree that I can play my chess and nothing can get in the way.
Are you sure you need a drug?
Yes! I'm positive!
So you need this drug to function?
Yes. Without it, I don't feel the same.
And what do you mean by that?
When I use it, I'm unstoppable.
Is that with chess, or is it in life in general?
With life in general. See, I get my straight A's when I'm high.
Now let's see what Penelope is like with her drug of choice. Let's go to a flashback.